setting up the patient dissection for the clinical tissue. So we've got a bladder cancer sample here that we obtained through surgery. And the idea is that we're going to preserve it and fix it to look at histology later. We're also going to be able to take frozen chunks of the tissue and look for molecular and DNA analyses. So kind of profile the patient's molecular features, and we'll be able to look at the blood as well. So the idea is that we'll be able to check for biomarkers in the blood and look for leukocytes in white blood cells and determine what kind of state the patient might be in. And all of these will go into one kind of pipeline to determine what kind of drugs the patient might respond to and how we can help this patient out longitudinally with their cancer. Now, this patient's actually in the first stages of their cancer curative treatment. So they've received a staging biopsy, a TURBT, and this will be used to look at what kind of cancer the patient has, what stage it is, how aggressive is it. So our rationale here now is can we kind of cure the patient's sample right now so that the clinician's armed with much more advice when the patient comes back to get curative treatment. So that's what I'll be doing right now. First things first. Just dissecting it out. So Dani, if you look at this, all that black stuff is diatomy, so that's when the surgeons use a laser to take it out, and you can see the black necrosis. Yeah. And all that kind of pink stuff there is the live cells we think. So this is an exophytic tumor, so very papillary, and we expect they're all to be quite alive and nice. You can tell by how juicy it kind of looks in a way. So I actually might just go ahead and take a large section of that histology.
Is that the one that you're doing the efforts where you slice it up?
Yep. Paraffin, actually.
Paraffin one.
Yep. So that's all we need.
Because we're building out one. You guys do
tissue slicing.
Well.
Yep. So we take deli slices of the patient's tumour. So we'll embed this in a nice kind of medium that's very solid, and we'll actually deli slice it. Kind of very similar to Woolies when you're getting a bit of your hand. And we put those slices on tissue sponges in culture. And what the sponges do is they actually absorb the media up in the drugs. So they provide this really interesting air-liquid interface. And we can kind of rapidly cut sections, treat it for 6 days in drugs, and have a look at the way the cells are afterwards. So we stain them for markers that are either alive or dead. And we say, well, chemotherapy has done this to the tumour cells. Immunotherapy has done this to the tumour cells. In fact, we've just started making a new model to look at immunotherapy response based on this kind of model with tissue slices. We think it's a very replicated model to look at the microenvironment of the tumour. This is just to look at the way the tumour is inside as well, so the microenvironment. So what we'll do is this will get embedded in embedded in paraffin. Yep. And it will actually be sectioned up and sliced, and we'll have a look histologically what it is. So all we do is fix it. So into formalin overnight. With the patient we received about an hour ago as well, we had 2 today. And we'll leave this overnight, and the next day take it up to histology and get a paraffin embedded. We have a few options, and what we'll do is we'll actually take some for organoids, cryopreserve them, and take some for fresh frozen. And given this tumour is actually quite friable, we can probably just use the blunt end of scissors to kind of section it a little bit. See how easy it comes out this one? So this indicates this tumour is loosely aggregated together. Yeah. It's coming off the polarized side of the urothelium, so the lumen part of the urothelium, and it's popping out. And the clinicians kind of cut through that to obtain the sample. So nothing too deep into the patient's tissue. And they'll get a pathologist to look at this and check it out. Now, a little bit different to other research teams, we actually use Snapchat as a way to help us profile the patient's tumour. So what I'll do is take a photo. I'll save the image, and then I'll annotate it using Snapchat. And that's a way I can say, well, this part is going to go to fresh frozen, FF is our code. I might change the color. This part, and go to more histo. These parts, I think, with a cryopreserve. And these parts here, I might take for organoids. Save that. And then what you do is just send it to your research team. So my top friends are my 2 master students, because we send it straight to them and they screenshot it. And then we have an online kind of record, de-identified record in real time of what's happening. And then we actually we'll take that specimen out. What we've done with the patient sample. So we use Snapchat as a really useful social media tool to help us do clinical samples.